Greetings and welcome to this episode of Everybody's Business. I'm Jerry Ross, your host and president here of the National Entrepreneur Center. And in studio today, I have Rachel Madsen joining us once again.
Hey, everyone.
Rachel is the client experience specialist here. And so if you're a client of the National Entrepreneur Center, you've probably met Rachel at the front door or at the front desk. And she makes sure that everybody gets into the right place and gets connected. So getting connected is really important for any small business. You don't have to do this alone. You can get connected with the National Entrepreneur Center at our website at nationalec.org. You can get a list of all of the resource partners that are here. They provide free coaching, absolutely amazing training that is hard to get anywhere. We have online training, which you can access at nationalec.org/online. How creative is that? There are many ways to connect. You can also enter questions for the podcast that we will answer online right here at Everybody's Business. So get your questions in. If you have questions about your business, if you have questions about things that we've talked about, we're as close as your computer. You can send us those questions at hello@nationalec.org, and we'll answer your questions. And one of the questions I was thinking about today, knowing that we're going to talk about insurance today, I regularly review all the insurance policies here at the center, but also for mine personally. Mm-hmm. And there are a lot of different insurances out there.
It's scary.
It is.
Some things you didn't know you need insurance for.
Well, and sometimes you say, I don't need that, but the day after something happens, it's too late to get the insurance. And so you have to think about all of those negative things that could happen to prepare. So do you have insurance?
Yes, but probably not as much as I should.
Well, and I didn't even say what kind of insurance, because, you have liability insurance in business and at your home, mm-hmm. Because we live in a society where people like to sue. And so
Sue happy.
Sue happy. That would be difficult if your name was Sue,
True. Sorry, Sue.
Everybody wants to sue. But also property insurance, because you never know if you're going to have, here in Florida, we have hurricanes regularly. Yeah. And so having property insurance is one of those things that you need to prepare for both personally and for your business. Life insurance. No one likes to think about the fact that nobody makes it out of here alive. We all have to deal with the fact that someday we may pass away and have people that we want to take care of, or have outstanding debts that need to be taken care of. Auto insurance, is...
Oh, yeah. Especially in Florida.
Especially in Florida. And so there are so many different types of insurance that I think, first of all, it takes some focus to go through all of them. And second, that takes time to go through all of them. But it's also one of those things that you have to regularly review, because your life changes,
Policies change.
That's right. So do you spend a whole lot of time thinking about health insurance?
Definitely not, but I should think more about it. I'm the one we should be wagging your finger at.
Wagging your finger at, saying, you want to think about that. Well, when you get older, that becomes more of a priority. And especially with the experience that we've had with COVID-19, when they talk about the people who are at risk, you need to have insurance to make sure that you can get access to the care that you need. And so for any business, and even personally, if you're an entrepreneur, thinking about what might happen to the business if something happens to you or someone in your family, someone that you love. So insurance,
think forward.
You have to look forward, but it's also one of those topics that's all-encompassing. It impacts so many different areas of your life and your business that we could probably spend a show on every type of insurance.
Let's do it. Just kidding.
Let's do it. We'll do a marathon. We're staying here until we talk about every form of insurance. And I don't know why I do an old man voice. It's like, get off my lawn. But somebody young could say it in a young voice. I'm young. I could say it in a young voice.
You are. You're as young as you feel. Except when it comes to insurance.
Exactly. And then you have to fill out all the right boxes that I can't read because the print's too small. So who are we talking to today? I know we're talking about insurance.
Yes. So we have Christina Pinto. She's the partner at MPC.
MPC provides insurance and financial planning. So we're going to take a break and we'll come right back with our guest today.
The National Entrepreneur Center has made it easy for you to learn business principles from anywhere at any time with NEC Online. As a supplement to all the great resources at the National Entrepreneur Center, you now have free access to over 300 learning modules that you can access at any time. Thanks to the generous sponsorship of Wells Fargo and our partnership with The Lonely Entrepreneur, you can access this powerful online learning platform for free. Learn on your own time and at your own pace. Access product reviews and participate in weekly group coaching opportunities. Right now, the only thing missing is you. So check out our online learning platform today at nationalec.org. That's nationalec.org. Did I mention it's free?
Welcome back to this segment of Everybody's Business. I'm Jerry Ross, your host, and this podcast is sponsored by the National Entrepreneur Center. Coming up, we have a special guest for you today, Christina Pinto, who is a certified financial planner and partner at MPC Wealth Management, which she joined in 1998 after a long career in banking. With her experience in banking and her expertise as a CFP, Christina helps clients navigate the complexity of financial management and long-term care planning. Long-term care planning became a passion for Christina while she was guiding her mom, Xiomara Cuellar, through the decisions, the financial challenges, and the maze of life circumstances that are related to a long-term care event. Christina is committed to giving back to the community, and she devotes a significant amount of her time to volunteering, which is how I first met her. She has served as the statewide and regional board chair for Prospera, currently serves on the Hispanic Heritage Scholarship Fund and the City of Orlando's nominating board. She's a member of American Heart Association's Go Red for Women and United Way's Women United. And it's my pleasure to welcome today Christina to this edition of Everybody's Business. Thank you, Christina, for joining us today.
Thank you, Jerry, so much. This is an honor and a pleasure.
Well, I would love to start with, tell me about how you got into being a financial planner. I know you spent years in banking. Tell me about that transition.
So it was actually my current business partner, Tony Marino, which we knew each other from the community, were friends, and never really reconnected until one day we did, and he reached out to me, and I was helping him with his financial planning clients. I was providing loans and second mortgages and so forth while in banking. So one day he said I had to make that jump into the entrepreneur world, and I was a little hesitant, but 1998, as you mentioned, and I haven't looked back. So it's been a great ride. It's
a little scary sometimes to make that step, isn't it?
It is. Absolutely.
And so what did you find was the scariest part of that? From moving from, working for corporate America, working in a bank to working on your own?
Well, I think one has to have very good work ethic, which I always did, whether I was an employee or then a business owner. And it's a little scary because, the 15th and the 30th of the month don't necessarily mean you're going to get a paycheck, right? And your benefits, your holidays are paid. So then you begin to work holidays because it doesn't really matter. And so my dad was a business owner, and I grew up in a household that, he didn't really take vacations and was always working. So I've tried to copy a lot of what he did because he was a great businessman, but also look at things that he may have done differently, like take vacations and take time.
You do have to take that me time. What kind of business was your dad in?
He was a locksmith in downtown Orlando. Many folks still come up to me and remember him, Robert Cuellar. And he was in the building that's currently the City Arts building, the green building.
Oh, right.
and Pine. So there is a plaque with his picture on it in the building because he was the longest tenant without a lease. He was on a month-to-month lease for 1972 through 2000 when he passed.
Wow, that's quite a legacy. And there's something about being in an entrepreneurial family that kind of rubs off. There's that feeling of my family used to say, if Dad has a project, we all have a project. and so that's part of that entrepreneurial family dynamic that includes you in the business. What are some things you learned from your dad that you've applied to running your own business?
Well, he was a very hard worker, and he always used to tell me, if you're going to work this hard for someone else, you might as well do it for yourself and make more money. And I think it's also interesting as an entrepreneur, and you've been an entrepreneur many times yourself, that you don't look at it as that risk that other people look at it, right? You think it's kind of natural. And I think growing up in a family where, we were always talking about different ideas, and the shop, was always, but then again, like you said, what I did learn also is those boundaries, the balance of, you have to cut it off at some point or it can consume your life.
That's right. And there's also the feeling that when you're talking about those new ideas, it spurs that brainstorming kind of session around the family table, that you can vet those ideas, because I always say entrepreneurs have lots of ideas, but not necessarily all good ones.
Exactly.
And so tell me about your mom and working with your mom on long-term care, because that's kind of a new area for you.
Yeah. So as I mentioned, our firm is independent. So we specialize in different areas: financial planning, investment management, business succession planning, in addition to the long-term care planning, which is my focus. And that focus came about from my passion of helping her over the last probably 10 years. And, it's funny because she had a caregiver, and part of that was, our foresight of getting her long-term care insurance policy, which we can talk about in a little bit later, that she did not want. But that enabled me to be able to be a caregiver in addition to her having a caregiver. So there's always so much more to do. And as we went through that journey, I realized not everyone has a Christina, right, to help them.
That's right.
And an advocate. And so she always told me, what would I do without you? I'm like, you don't have to worry. I'm not going anywhere, right? So over time, Jerry, that just became a passion of mine, because I saw how important it was that she had her policy, that we had options, that she could pick wherever she wanted to go. And later, very, very late in life, she finally realized the value and the importance. And she would say, I'm here because of that policy you did, right? And I would say, yes, Mom.
Exactly. That policy that you fought me about getting.
Every month.
Well, everyone who has parents that are aging, getting older, has thought about, what am I going to do? And as our baby boomers get older, we start to look at, how do we deal with an aging population? My in-laws had coverage and care, which was instrumental because we were remote, and to have someone that looked after them to make sure that they took their medicines and that they had 3 squares a day, really kept them healthy and happier much longer than we could have done remotely. So especially as a business owner. And so if you're not running your business and you're taking care of mom and dad, you've got to have help. Christina, people look at long-term care sometimes and say, I don't need that. I'm going to live forever. I'm an entrepreneur. I'm strong. I got this. But there are a lot of different aspects, not just caring for a loved one, but protecting your retirement, providing a way to run your business while taking care of someone that you love. Can you speak to the different reasons someone might get into long-term care insurance?
when I speak to folks, it's exactly what you said. It's giving that loved one, number one, the option of being where they want to be, not where they have to be. That is huge, huge. Number two is, look at, you're going to pay those costs one way or the other. Why not leverage your money today instead of paying dollar for dollar? Have the insurance company partner up with you and leverage those funds today so that you're not paying dollar for dollar and creating a much larger pool of money to then pay for care. So it just really becomes more of a more holistic approach. It's not just about a policy. It's really about them, their family, their loved one. And Jerry, especially when you have families, like me, I don't have kids, and so, my boyfriend moved in over COVID, and our first conversation was, we need to get a long-term care policy. I'm sorry, this is not romantic. It'll be easier to have someone take care of you when there's money involved. And
I'm behind you, but I'm just very far behind you. Well, we're going to take a break. And when we come back, we're going to talk about your journey as an entrepreneur and also your advice for entrepreneurs who might be listening. So we'll be right back. Don't go anywhere.
Prospero specializes in providing bilingual assistance to Hispanic entrepreneurs trying to establish or expand their business through training, support, and resources so their businesses can grow and prosper. They offer workshops, new business orientations, individualized consulting, and personalized guidance for funding options, all targeted towards Hispanic business owners, and all for free thanks to generous community funding. Economic opportunity is a powerful catalyst for positive community change, and Prospero has been at the heart of that for Central Florida's Hispanic business community for nearly 30 years. Nos interesa el éxito de su negocio. Acepta nuestra ayuda y ahorra tiempo y dinero.
Now, here is your host, Jerry Ross.
And we're back. We're talking with Christina Pinto, who is an entrepreneur here in Orlando and a certified financial planner. We've talked about long-term care and how that can protect your retirement, but also allow options for those you love. Now we're going to talk, Christina, about your entrepreneurial journey, moving from being a banker into a certified financial planner, and now creating a new business to talk about taking care of folks as they age and long-term care. Tell me about the biggest challenges that you faced as someone who's jumped into a new market with a new business.
So that's something I have not done because I joined the firm as a partner and all those little basic foundational things were completed. So
that sure makes it nice, doesn't it?
Hate to admit it, but it's not easy. But what has helped is we're doing it slowly, we're doing it right. And I think the biggest thing that I learned from my dad that I'm not doing is he was a very private man, very private man. He didn't believe in sharing anything so that others could help him. And so therefore he did not surround himself with good people to give him good advice. And that's the one thing that, I have learned to do differently and are doing differently today.
Well, and you've had connection with some of those organizations, even here at the National Entrepreneur Center, that are here dedicated to helping businesses and providing input and perspective for them. What kind of input and help have you received?
Well, we've met with Augusto Sanabria at Prospera. So we, definitely he was my first option. I also had reached out to you early on. This has been an idea that not really realizing I was formulating a process in the process that I had to put in place for my mom, right? To be organized, to continue to run a business, to have somewhat of a personal life. This process is now one we're going to be implementing in our new concierge company, which hopefully once it's launched and everything is ready to go, we'll be able to do another segment on that company.
That's right. That's right. Because that's some exciting planning that's going on right now. Have you picked a name yet?
Long-term concierge.
Long-term concierge.
And our tagline, if you would, will be the greatest gift is a plan.
What's one thing that, through your experience, that an entrepreneur should make sure that they do or make sure that they don't do?
So in addition to what I alluded to as the professionals, which I feel strongly about, I also think we try to do it all because we can. I remember my dad as a locksmith, and this is funny. He decided to open up a similar, like what you would call a CVS at the time, a little convenience store, and my mom had to go work. And then he decided to open up a laundromat, which of course. And I finally said, Dad, stick to what you know. It's more profitable. My poor mom is not working on these businesses. So, one of the things at our firm is we are a group of specialists. And I think when you follow your passion and you know that's what you enjoy and what you like, it makes it easy. And you're specializing in one area versus trying to be everything to everyone. You can't because you'll end up either failing or disappointing. And I've learned that, I try to, financial advisors are known for that. We do it all. And over time, like I said, we each followed our passion, and now we each have our own specialty and work as a team to help clients. And it's perfect. It works.
And with the overwhelming amount of change and data and uncertainty, it's really hard to keep up on everything. So if you can have an area of expertise that you know a lot about, that's what makes it something that can have impact. I find myself sometimes people telling me, "No, Jerry, come back. Focus." I used to be in the entertainment lighting business. And so we were working at the Atlanta Olympics. And because we were there early and set up for all of the rehearsals, I had people standing around that I was paying a lot of money. And so I got them involved in selling cardboard binoculars to spectators. And so I had these highly paid Xenon technology people selling dollar binoculars to people going into the event. And at the end, after we lost a lot of money doing that, I said to my advisors, "Where were you? I needed you to tell me that's a bad idea." And so it's really important to get that kind of input. We're going to take another break. And when we come back, we're going to talk to you a little bit about COVID and the response to COVID and what you've seen. And then we're going to wrap up with some really important personal questions that we need to know from you, Christina Pinto. We'll be right back, so don't go away.
The National Entrepreneur Center in Orlando, Florida has been around since 2003 and today is home to 14 business support organizations who have a single mission: to help you grow your business. Through free business coaching, low-cost training, and valuable business connections, these 14 business support organizations assist thousands of entrepreneurs each year in starting, growing, and scaling their businesses. So why not visit the website at nationalec.org today, or give us a call at 407-420-4848 to discover how you might take your business to the next level. And by the way, the National Entrepreneur Center is funded entirely through local sponsors, which include Wells Fargo, Orlando Utilities Commission, Regions Bank, and the Corridor, just to name a few. So let's get connected today and get growing. Check out our website at nationalec.org.
Okay, we're back, and we're talking with Christina Pinto, a certified financial planner here in Orlando, who's also an entrepreneur and working on a new business idea. Christina, what I'd like to do now is to pivot, which is the new word of the day, to the topic of COVID-19 and how you've seen businesses that have had to adjust and how that's affected even your business.
So, Jerry, it's been an interesting 6 months. I can't believe I'm saying that. And nothing for sure anyone would have planned on. And I think as entrepreneurs, we tend to just do what we do because we've always done it that way. And, as a firm and personally, and I think other businesses that I see, we've had to adapt. Technology is our friend. Use it. Don't be afraid of it. And, with us, we were doing paper applications, and, I was not a fan of the e-app, and it was impersonal, and the e-signatures. And you know what? Now my assistant's like, they don't offer this. This company doesn't offer e-signatures. So even in our industry, which is so regulated, it's just amazing how much we have pivoted, to use your word, into this new norm, right? That has forced us all to be a little bit more efficient. And just because we did it that way doesn't mean we have to keep doing it that way. So that's kind of our mindset whenever we look at anything we're doing.
As we're talking about COVID, we had an interesting conversation about some of the creative ways that nursing homes are dealing with the COVID. Can you talk about some of those things that you were sharing with me?
Yeah, so Jerry, I think the elderly during this whole pandemic have probably been affected the most. Their families themselves, because I have a lot of friends that have not seen their mom since March 14th. Like I know. And I would be in jail because I would have broken in, or I would have done something. I would bail you out. Bail you out. Just make sure I have food. I like to eat. So, and speaking, and they're not all, and I understand their safety issues, but I think as business owners, as entrepreneurs, we have to adapt, and you're trying to keep them safe. And I get that, but there are some, memory care facilities in town that I think are doing a brilliant job in keeping them safe, but also keeping them from getting so depressed that they may die anyway. And it's not going to be from COVID. So for example, they're setting up tents outside, and they have, it's costing money because now there's a dedicated employee that's sitting in the tent and monitoring to make sure everything is safe and everything is secure, but everyone's wearing their masks, there's social distancing. But guess what? You can see the person. You can't touch them, but you can see them, you can smell them, you can hear them. And I think that's going to do wonders, because you have so many of these elderly folks that aren't really ready to go, but this depression and loneliness is killing them, to be honest. Loneliness is a big issue, and just being able to see them and they can hear your voice. I've seen some of the drive-bys where they have the cars that drive by, and the things that people are being creative to try to help, because we are social beings, and we love to be with each other. And I think that we're in the process of reopening, and so we will get back together. But you're right. It's been a long time, and I miss my son. I want him to visit me now. I know. I miss hugs. I'm a hugger. Me too. I can't hug. We need that. So as we do that, I would just caution you: don't break in anywhere. No. And so don't worry. If you get really close to it, call me. I have your cell. I'll take care of you. We're coming up on a break from our sponsor, and we will be right back, so don't go anywhere. As we go through this year of the pandemic, many of us thought that would only be maybe a few weeks, maybe a month, but now that it's gone on for months, people are realizing that maybe we're not going to be doing business the way we used to. Maybe business has changed forever. Whole workforces have pivoted to working from home. Schools closed, businesses closed, live events canceled. COVID-19 has pretty much turned our daily lives upside down. Dealing with a global pandemic has also made us rethink how we do everything. Schooling our children to serving customers, it's difficult. Any kind of change is difficult. But when you add to that all the uncertainty that comes with an unpredictable virus, a virus that could be fatal, it's no wonder that folks are feeling a bit stressed these days. So if you are feeling stressed right now, it's okay. You're normal. What you need to know is that you're not alone. Most everybody today is feeling the stress of the situation. Maybe in different ways, maybe with different circumstances, but believe me, everyone has been affected. It's okay.
not to be okay right now. You are allowed to take time for you, to regroup and to recharge. I think there are some aspects of what we've found from working remote that are good, that we've learned to use different technology. We've learned new ways to stay in contact with each other and with our clients. And I think even when things do get back to normal, whatever normal may be, that we'll find that some of these aspects of technology and video conferencing, online learning, all of those things will be carried forward into the new way of doing business. Remember, in times of chaos, there is always an opportunity. Let's talk about Christina and you and your journey. Where did you grow up? Where are you from originally?
So I was born in Havana, Cuba, and have not been back. We actually tried to go back on a cruise ship, and that's when that got taken away from us again. And we left when I was 4. My parents were both born there. And my dad, though, did live in New York in probably the late 40s.
Okay.
So he was a locksmith there from Mosler. And so we had a little bit of a hard time leaving Cuba because he was pretty valuable. He knew a lot of information. He was a great locksmith. Him and my mom actually built safes from scratch and painted them and the whole 9 yards. So you left Cuba and you either stayed in Miami or went to New Jersey or New York. So we ended up going to Jersey City, New Jersey.
Okay.
And was there until I was 10 and then moved to Orlando. So pretty much been here all of my life.
So you've been here long enough to be a native.
I guess so.
I've only been here 30 years. So
exactly. I didn't want to get into all that, but.
That's right. So what did you want to be when you grew up?
So this is kind of funny because I had not thought about this for a long time. And the other day, my boyfriend and I were talking, and I found this outfit that my mom used to sew all my clothes, right? Okay. And it is, I don't know why I still have it, but again, I keep everything just like he did. And I was in chorus, and we used to sing at the Fashion Square, which is the mall here local where the NEC is housed. And I was up there singing and performing, and it was all good. So I think at one point that's what I wanted to be, but I'm not a good singer. So
you had visions of Broadway.
Yes, but that did not come true. But it's okay.
Where have you visited that you would love to go back? Italy.
So I had a good friend that was in the travel business. So anytime she asked me, I said, my bags are packed. I went as her buddy. And so was able to go to Paris and to Italy and to all these different destinations very quickly. But I thought, okay, one day I'll go back with someone special. And we were planning to go to Italy this summer. And I would love to do, which I haven't done, is the whole Venice, not Venice, but Venice as well. But I'd like to do Tuscany and the wineries and just kind of experience the culture, not necessarily, I've already done all the touristy sites.
Sure. If you were president for the day, what would be your priorities?
So I only have one day, so that's the problem.
One day.
And I'm Cuban and I can't be president. But other than that, again, on my journey, I feel strongly that everyone needs an advocate, whether you have children or not. And so some nursing homes and memory care places are awesome and some are not. And I would really figure out a way to give these elderly people the place they deserve. They deserve, a great place. I don't understand why the food can't be better in some places. That's just not, that's very basic, but I would make sure that we take care of our elderly population with the dignity they deserve. And it starts with making sure they have good options to live when they can't live on their own safely at home.
Before we wrap up with our final rapid round, how do people get a hold of you to get more information on long-term care?
So our website is mpcfinancialplanning.com. And I'm on LinkedIn. I'm going to be posting actually a video that I created about my journey and my story with my mom, pictures. I was hoping it would be with her. And that's going to be, I believe we're posting that today. And Orange Appeal also has an ad and my information is there. So website is probably the best way to reach me.
Sure.
Or my email address.
So Christina, we're going to be a good steward of your time and let you go, but not without knowing something really important. And that is,
Dirty secrets.
what is your favorite dessert?
So a warm bread pudding with vanilla ice cream.
Oh, wow. I'm
Warm.
in. I'm warm. It's got to be warm.
Yes.
Favorite movie?
You know, I had to think about this, and I don't want to date myself, but I
Ben-Hur, is that?
Huh?
Ben-Hur. That's from way back. That's in the way back machine.
Not that bad. A Few Good Men.
Ah, okay. Are you a coffee or a tea person?
Coffee.
Movie or the book?
Movie.
Pie or cake?
Cake.
Your favorite TV show?
So right now we've been watching Shameless, and it's a little bit embarrassing, but it's something that's brainless and fun to see what trouble they get into.
There are times I just need mindless TV to let my mind take a break. If you were taking a vacation, would you go to the beach or the mountains?
Beach.
Ballet or opera?
Ballet.
Beer or wine?
Wine, but I do like craft beer.
Ah, okay. So and I go either way too. I can go either way. Thank you. Thank you for spending time with us and sharing your experience with us today. And thank you for being with us today on Everybody's Business. I'm your host, Jerry Ross, and we'll be right back.
Thank you.
We have a special segment coming up for you that we recorded in the past, but it's relevant even today. Tony Jenkins, the market president from Florida Blue, joined us to talk about those things that you should be aware of and that you should be thinking about, especially during an open enrollment period for choosing your insurance provider and choosing your insurance levels. So stay tuned. This is special. Please welcome Tony Jenkins. There's a lot of confusion in terms. There's a lot of confusion in what's out there. And also what happened over the last few years in healthcare. So I want to start out with, what is healthcare and why is it important for us?
Sometimes it's something that we think we may need, or we hear about it. But I will tell you, even if we don't have it right now, I will share with everyone in the room, at some point, you're going to need it. We just don't know when. It's either now or later. And I would tell you, health insurance protects us. It protects us from severe financial hits to our family. And it gives us a certain amount of coverage and security that, again, at some point, I think that we all need. And I know we'll talk about it today, but you'll hear about options. There's not just one option. And I think that what we have to do is think about what are the best options for all of us. I remember when I got out of college and I was younger, I thought, don't need it, I can wait.
Bulletproof, right?
Absolutely, all of that.
But as we get older,
Yes.
we start to realize that we're going to need health services.
Absolutely.
And that's when insurance becomes really important.
Basically, health insurance is really just a contract between an individual and their health plan to offer financial protections, whether someone is sick or whether they're healthy. Basically, it's there to offer them that care.
When the discussions around related to healthcare reform were taking place in this country, it was really talking about at the time, the over 40 million folks or so in this country that were uninsured.
And those were mostly individuals, not
yes.
part of a group plan.
Not part of a group plan. And listen, people were uninsured for various reasons. Some people thought that that individuals that were uninsured were those folks that were unemployed or not working. But uninsured fall into many different categories. If you've had a job and you may have lost it for a certain period of time. Sometimes very small employers don't offer health insurance as well. So there are many factors.
Or sometimes you're young and think you're bulletproof and say, I don't need that.
You got it. You're absolutely right. And so what was happening was, as those discussions began to take place, there was efforts in the country around helping to solve some of the uninsured crisis, because a lot of those numbers were putting still a strain on the total cost of healthcare in this country. So when you think about what are the different ways that we could try to address it, one of those was to try to ensure that we had individuals that did not have insurance. What were some of the ways that the government could potentially offer assistance to be able to have folks insured with several different products?
And so what does that look like today?
Since 2010, and it's gone by different names, the 2010 Affordable Care Act was passed, and some people call it Obamacare, Affordable Care Act. It's the same thing, where individuals, if you fall within a certain level of federal poverty income, and it's between 100% and all the way up to 400% of federal poverty level, then you qualify for tax subsidy credits, where subsidies, you can get assistance depending on your income to help pay for your monthly premiums.
And that's up to 400% of the poverty level.
Yes.
So what number is that?
Yeah. So if you're an individual, and if you're probably between the income levels of $12,000 all the way up to $48,000 as an individual, then you can qualify for some levels of a subsidy.
A subsidy for paying your premium?
For paying your monthly premiums.
Okay.
Correct.
What about a family?
So if you're a family, for family of four, probably ranges from salaries from $25,000 or so up to close to $100,000, $95,000, $96,000. And listen, I say that because there's some that would think that it only covers someone that's very, very low income. As you can see, this goes pretty far up into some middle class numbers. So again, it's not only for those folks that are at the lower end scale of a pay range, Jerry.
So a family of four making $90,000 can get assistance for paying their premiums.
Yes.
So all of the marketplace plans come with all of these coverages, basic coverages that cover the things that all of us should be interested in.
Like
it covers all your doctor visits.
Okay.
If you need hospital stays, your prescription coverage.
That's important.
Mammograms, there are preventative services in there as well.
Like
vaccine shots, flu shots. So all of those things are important. And the good news is that these coverages through these plans cover all of those basic benefits.
To me, the most important part of anyone having health insurance is to make sure that you're aligned with a primary care physician, a PCP, to make sure that someone is actually helping to manage or guide you. A plan is going to vary, but it's also up to you, because there are four types of plans.
They're called platinum plans,
right,
gold plans, silver, and bronze. And that's where someone can go out and, based on their own personal situations, they can determine how much coverage they would like for the health plan to cover. Like the premium plan, top of the line,
right,
is platinum.
Okay.
And if someone feels like they may not have a lot of medical costs, or they think they're feeling pretty healthy, I don't
need some of those benefits.
You're right.
I don't have to pay for them.
You're absolutely right. And therefore, the platinum plan, the health insurance company will cover 90%. of your medical expenses, all the way down to the bronze level,
Okay.
where the bronze plan will cover 60%.
Those different plans will offer different costs based on what someone you feel is best from a price point for you or your family.
So if I want to pay a lower monthly premium,
Yep.
I'm probably going to pay a higher deductible.
Correct.
If I want to pay a higher monthly premium, I'm probably going to have less deductible and more service.
Well, and also I will tell you that the other aspect that you have to think about also, in addition to your monthly premium, is you also have to think about your out-of-pocket cost, right? A lot of people will only focus on their premium. Take a look at your deductibles. And a health insurance deductible is similar to a deductible and a lot of other insurances that are out there, meaning that before your insurance begins to kick in or pay, then that deductible amount has to be, those are your costs that you're going to be paying before your insurance kicks in.
So if I'm young and bulletproof,
Then-
I might think I'm not going to get sick. I can have a higher deductible
Yep.
and lower premium. But as I get older and feel like I may need to visit the doctor more, I may pay more monthly and have less out of pocket.
And here's what, correct. Here's what I ask people to do. Take a look at your trends with your own family trends. Because annually you'll have to make these decisions. Take a look and see if you've got a family and you've got 3 children, and over the past years, the scrapes, the bruises, the broken arms, the soccer kids and the football, and there's a lot of trips to the ER or the doctor, and you yourself may have had medical conditions during the year, then you need to pick a plan where you know that you're going to be visiting the doctor quite a bit, and you need to plan for that and make sure that you've got the right coverage to make sure that you're considering all the financial ends of that cost.
For anyone that might not know what a pre-existing condition is, what is it?
So there were, if you in the past showed signs of what we call being a pre-diabetic, and if you put that on, that
High blood pressure,
high blood
weight.
pressure, some chronic care situation that may be temporary, that may have maybe contributing to some health condition, all of those fall under the pre-existing category of where a healthcare company would have considered you a high risk, regardless if someone has a pre-existing condition. When you go to fill out any information, either healthcare.gov, you sit in front of an agent, you come to us, there are not any questions related to your health status. It's going to be based on your income. It's going to be based on your zip code, your counties. But I will tell you, a lot of folks, because the pre-existing condition issue was so prevalent, and people, we all remember that folks were getting denied. And because of a myriad of various questions that you may have answered, and you may not have known, why was I denied? And you thought, well, sure, probably because of this. And because of that history, there's some folks, the residue of that is still out there. Is that here's an interesting fact, is that even today, that we encourage anyone to go out and shop. Just go out. There's still a fairly significant number, I think, of folks that are still not even going out and looking for coverage. And we're asking questions, and we know, again, a part of that, Jerry, are the invincibles. Folks still feel that I don't need it, but are there other reasons as well? And we're trying to understand what are some of those things that we could educate, inform, provide information to even just consider what you need to do for yourself individually or your family.
There's a certain enrollment period.
Okay.
And for this year, that time frame begins November 1st.
Okay.
And extends through December the 15th. So that's the window. So
That's the window
anyone,
when you can look at the plans and change plans maybe that you're on.
sure, yes, yeah.
What happens if something happens during the year that's not in that time frame?
So once someone signs up if they sign up for that individual plan during that period,
Okay.
The annual enrollment period each year falls within that window. But if an individual experiences some life change,
Right.
if they get married, or if they're in the area and they're moving, if they move outside of their current county, that qualifies for them to then go in during the special election period and make additional or new choices related to their health plan.
You can go to healthcare.gov, which is the government's website. But you can also, there are many other things you can do as well.
What we've done across the state is we have built these Florida Blue Centers. And Jerry, it's a place for individuals, families to go into for additional expert advice. But not only advice, we've got nurses in the facilities where they can potentially get care. With customer service advocates there.
Really?
For someone to come in and ask questions about their health insurance bill. And we found these centers to be a great resource to individuals to begin to get into some of the nuts and bolts of what they may view confusing, to clear up a lot of information.
We have a wonderful group of, and this is, to us, this is our preferred channel. Even our retail center is wonderful. We have a preferred group of agents that we contract with, that they're really our front lines to talk with customers and members, and they could help individuals walk through the process.
Let's give a warm thank you to Market President of Florida Blue, Tony Jenkins.
If you have a business question that you would like to have answered, or if you would like to suggest a topic for discussion, we would love to hear from you. Just email Jerry at hello@nationalec.org. That is hello@nationalec.org.
Wow, long-term care insurance, one that I hadn't thought much about. But as I get older and I look at my family, one of 11 kids, and I'm one of the youngest. And so my brothers and sisters are getting up there. So it's one of those topics that, as we were talking about it today, I thought, boy, I need to look into that. How did that affect you?
Well, just speaking as, someone relatively young.
Yes.
It really puts things into perspective of, no, Rachel, you're not that young. So you need to start forward thinking and think long term, basically.
But also those people around you that are getting older that, if something did happen to them, that they were incapacitated, how am I going to care for them? Because I would want to care for them. Especially during these times of open enrollment and COVID.
Uncertainty is everywhere.
You start to say there are a lot of things that we just don't know about that we probably need to learn more about. So interesting episode. I always learn something during these episodes. And so our thanks today for our guest and the information that they've shared, and our special thanks to you for being a listener of Everybody's Business. We're glad you're here, and we appreciate the fact that you come back every week because we bring you new topics that not only make you think, but make us think as well. We'll see you next week.